Hello, this is Dr. Steve Horwitz, www.marylandsportsinjurycenter.com. Today we're going to go over CPR and AED training, specifically for sports coaches, parents, and referees, those of you that may be at an athletic event. Number one, some specific pointers for these situations. Everybody needs to have a pocket mask in their first aid kit. This comes in a little case. It's a mask with a one-way valve. It pops up, and this goes over the mouth and nose. Remember, the first rule of CPR is don't do any harm to yourself. So get yourself a pocket mask. They're available anywhere. Number two, if you are at an athletic event, it is very important for you to know where are you when you call the 911 operator. Schools are very large. They're very confusing. Are you inside? Which room are you in? Are you outside? Which field are you on? And what's the best way for the EMTs to get into that school or into that building? It's very important to think this out ahead of time, because in an emergency situation, thinking is not always the clearest that it can be. Number three, every coach should have a medication card and a medical card for each athlete detailing their medical conditions and any medications, because when you're on the phone with the 911 operator, it's very important to say, we have a 14-year-old, they're down on the field, they may or may not be unconscious, they're on such and such medication. So this way the EMTs can know exactly what they're dealing with when they come. So let's go through CPR, and we'll go through the steps. First step is survey the scene. Is the scene safe? Can you get to the athlete unabated? That's very important. Number two, when you're a coach, it's really extremely important to make sure there's another adult in the area, because when somebody goes down, the kids can get quite upset. So it's really important to have somebody to control the kids and to control any parents that may be around. So the second step is, Billy, 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 Annie, 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 are you okay? You're going to grasp the shoulders, not the head, because if it's a head injury, we don't want to make it any worse. The next step, if we don't see any response, is tell somebody very specifically, call 911, bring an AED, and come back. Then you may want to tell that third person, you in the yellow t-shirt, go ahead and calm the kids down, take care of that. It's very important to keep the situation calm. So, next step. We want to look, listen, and feel by head tilt, chin lift. Grab the forehead and the bony part of the chin, tilt up. We're looking for the chest rising and listening and feeling for any air. If we don't feel it, we're going to do 2 full breaths. That's complete breaths. 2 breaths. The next step, we're going to check the pulse. That's the carotid pulse in the neck. Check for about 5 or 10 seconds. If you're not comfortable checking the pulse, you want to look for signs like, are they coughing, are they moving? If neither of those are occurring, you can assume that there is no pulse. Then we're going to move to the compressions. The compressions are done on the middle of the chest, in the line where the nipples should be. We're going to place the heel of our hand down, lifting up the fingers, grasping the other hand in between the fingers, getting the shoulders directly over the victim because we don't want to strain our own backs, and we're going to do 30 compressions to 2 breaths. And it's a very quick rate. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12 and 13 and 14 and 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30, and 2 breaths. We want to make sure we want to go through 5 cycles of this, and then we're going to recheck. When doing the compressions, the rate is 100 compressions every minute, and that corresponds to singing row, row, row your boat. If you sing row, row, row your boat gently down the stream, if you sing that twice through, you will get 30 compressions. This way you don't have to count. And again, in an emergency situation, it's much easier to think of something easy than it is to think of something difficult. So 30 compressions, 2 breaths at a rate of 100 compressions per minute, and sing row, row, row your boat, preferably to yourself. You might want to not sing it out loud. Now we'll review an AED. That means automated external defibrillator. These are in every school. Each AED should have a little hanging kit that comes with the pads. These pads will be in this little plastic, so you'll have to tear them open. The kit will also have a razor. Should the young man have a hairy chest, we need to get the hair off with the razor. It will have this mask and also a pair of gloves. When we use the AED, if we're bringing the AED to the victim, we're going to place the pads on, and there's a diagram that shows you exactly where the pads should be. In this case, we follow the diagram, right high and left low. Just follow the diagram, place the pads on. Once the pads are on, we can turn on the AED. One note, most of the new AEDs require that the pad connector be in the AED before we turn it on. So in most schools, when you take the AED down, you will notice that this pad connector is already in the machine. We're going to turn the machine on, and it will tell us exactly what to do. In this case,
training mode, call for help, analyzing heart rhythm, do not touch the patient.
So in this case, it says do not touch the patient. We're not going to touch the patient. We're going to make sure everybody's away. And from this point forward, we just follow what the AED says. It's really pretty simple, and that's why they're designed the way they are. Thanks very much. Be safe. And if you have any questions, give us a holler at 301-622-9000. Thanks.